Good afternoon and thanks for joining us. I'm Judy Simpson. Our topic today is often difficult to talk about, but it's too important to ignore. Suicide is a major public health problem nationally, and in Vermont, the suicide rate is 35% higher than the national average. Today we hope to break through some of the myths about suicide and understand some of the risk factors and warning signs. Joining me are two guests. Melissa Southwick and Lisa Pate are both part of the Sash program, which stands for Support and Services at Home. I want to thank you both for coming in today. And Melissa, maybe you could start us out by talking a little bit about what Sash is and what you do.
Sure. So Sash is the integrated health model. We embed Sash coordinators and wellness nurses into housing sites throughout the state. We work with partner agencies like the Agency on Aging, the home health agencies, and the mental health agencies to provide care and services to help people stay healthy and safe in their homes.
And so Lisa, who can participate in Sash and where are the programs available?
Sure, so anyone who receives Medicare can participate in Sash, and it's available in every county in the state of Vermont, and we work out of hubs, so different housing sites, but we also go into people's homes as well, and we have a different program that's in Rhode Island now too.
Oh, excellent. All right. Well, Melissa, tell me a little bit about your respective roles at Sash, if you can start off with Melissa.
Sure. So I'm the operations and quality assurance manager. I basically oversee the Sash program statewide, make sure it's running well and it's the same everywhere.
Okay, and how about for you, Lisa?
Sure, so I work in 3 different areas mainly with our participants. The first is transitions, support, and coordination. So when they're moving from one type of care, from a hospital to home, or any type of scenario like that, we really work to help coordinate that kind of scenario. We also work with self-management, so I teach different kinds of classes and programming to really help them take the reins of their own health. So that they can better live independently. And then the third part is coordinated care. So we work with a lot of their different healthcare providers and person-centered support to help coordinate their care.
And so why are each of you using your Sash platform to address suicide prevention?
Yeah, suicide is the 8th leading cause of death in Vermont, which means that on average 1 person dies every 4 days. We know that it affects seniors at a significant rate, and we have a platform in place to work with older Vermonters and improve healthcare, so it seemed like a natural fit.
And when did you start focusing on this?
In 2015, we were approached by the Vermont Department of Mental Health and the Blueprint for Health program, and they asked us to participate in a pilot project of the Zero Suicide evidence-based program. So through that work, we participated in leadership trainings, and we had a strategic plan in place to educate our staff and our participants about suicide prevention and ways that they could help intervene that are safe and simple when someone that we know or work with is in crisis.
And so what is Sash doing to address suicide prevention?
Sure, so we have a lot of different kinds of programming that's created to sort of create social situations, so different kinds of luncheons to really invite people to join us. We also build that trust with our participants as well. So they see me on a regular basis every day, and so when I build that relationship with them, I often can start to see changes in different kinds of mental health because we do work with a lot of different kinds of mental health issues. And so I can see that change, and we also have we have an assessment that we use to really help address that and get that information, sort of from them in different ways that's not as formal. And that relationship sort of in that trust helps to really make that a comfortable sort of scenario for them to share that with us if that's what they're going through.
And I just would like to add that we've done quite a bit of work from the administrative and training point of view. We've created what we call our suicide prevention awareness packets. And so every site that we have has one of these on hand. Howard has graciously donated, the Howard Center has graciously donated gun locks for each of these packets. So if there's a situation right in the moment, the staff doesn't need to flounder and wonder what they had learned. They can actually go to this packet and get the resources right there. We've also trained all of our staff in the Columbia Suicide Severity Rating Scale, which is a tool that they can use to rate the risk level of what's happening. We've trained our 20 or more of our staff in the You Matter program, which is a peer-based gatekeeper training. So we provide that to our participants so they know how to help each other. And the last thing that we did was Howard provided all of our staff with a gatekeeper training. So we've kind of level set the knowledge base of our statewide staff.
What are some of the things that people are taught?
Yeah, so they're taught how to recognize warning signs, recognize risk factors, and what some of the resources are that are available to them.
Well, Lisa, let's talk about some of the risk factors and warnings.
Sure. So risk factors are things that might reduce someone's ability to meet their needs, thereby affecting their level of resilience. And these could be things such as poor health or financial difficulties or a big loss of a loved one. Warning signs are indicators that there's something wrong. So different causes for concern. And again, we know these people because we work with them every day. And so it could be outright threatening, their own suicide, or expressing any kind of wish to die, or giving away their items, any sort of behavior that's a big change.
Also, talking about wanting to die, talking about feeling empty and hopeless. What should family members, do you think, be looking for?
Big changes.
Yeah.
So really that giving away their items, suddenly wanting to clean everything out when there's never really been a need for it before. That's and like I said, those emotional changes. So if someone's genuinely happy and you start to see that change over time after the loss of a loved one, family members can really support by asking those questions, those big questions.
What are some of the myths about suicide? Because I think that there's a lot of misinformation about this out there, and it kind of hampers people from talking about it.
That's absolutely true. One of the most common myths is that if you ask the question, are you thinking about suicide, it somehow endorses the idea. And what they found is that actually is the opposite. So by asking someone, are you feeling suicidal, are you thinking of taking your own life, you actually have been shown to reduce anxiety. It lets people know that you are willing to talk about the topic and that you're there, you are listening, and you care. Some of the other myths are that once someone has the intention of suicide, there's no changing their mind. And actually, we found that that's not true either, because of the people that have a suicide attempt and survive, 90% of them do not go on to die by suicide. So you can help someone through an instance and they may not ever try again. And then the last is that you need to be a clinician to talk to someone about suicide. I often hear that, I'm not a counselor, I can't do this, but truly, while a clinician is a very important part of someone's care team, anybody can ask the question. So if there's someone that you're concerned about and you want to show that, there's 3 things you can do. You can show that you care, you can ask the question, and you can get help.
And so I think that's the scary part is for someone who might be a family member or a friend, you want to ask the question, but you might not want to hear the answer. And that's
absolutely true.
Hard.
Absolutely. You can't help if you don't hear the answer, though. So it might be scary and it might be hard, but the only way that you're going to help is if you can get to that answer and then figure out together. You don't have to solve this for them. You just have to know it's an issue and then help them find the resources that can help.
Okay, here's some other myths too. Suicide rates are higher for people of low income.
Yeah, it's actually not true at all. It's the same across the board. It kind of knows no boundaries, no race, no income, no. The one thing I will say is that gender, there does seem to be a higher level of men that die by suicide, especially in that age range of like 70 to 74.
Okay, most suicidal people are undecided about living or dying, and they gamble with death, leaving it to others to save them.
Yeah.
That's really sad. Okay, here's another one. Once a person is suicidal, he or she is suicidal forever.
Yeah, that's what we were talking about with not being able to change their mind. They've said that suicidality is actually very impulsive and it's in a moment. And so many times if you can help someone get beyond that moment, they will be okay. They can get the help they need. It's getting them past that moment.
And another was most suicides are caused by a single dramatic and traumatic event. That's not true, is it?
Not that I'm aware of.
Yeah.
I haven't actually heard that one before.
You know, once again, these are really hard topics to talk to people about. And I think probably the most important thing is if you are a family member and you do broach the subject and your loved one says, yeah, definitely, then you really need to say, okay, well, let's figure out a game plan and get some help.
Absolutely. Yeah.
And so you've put together a list of important resources. Lisa, how can people find out about them?
Sure. So we have the National Suicide Hotline, which is 1-800-273-TALK. They can call that number any time of day, 24 hours a day, and there's someone there to talk on the other end through that moment, like Melissa was talking about. And then we have local resources as well.
Yeah. So in Vermont, you can actually text, and if you're more comfortable with texting than having a conversation, which some people are,
Right.
Especially about topics like this that are more difficult, you can text 741-741, and you just text VT. Within 5 minutes, a trained professional will text back, and you can have a conversation over the text. You can also call our local intake resource and referral line 211. They have a suicide hotline as well. And you can go to www.mentalhealth.vermont.gov.
Okay, let's talk about your organization too for another couple of minutes, because you're really kind of on the front lines, you know, dealing with folks and helping people out with this topic. How can people get in touch with you?
Thank you for asking. It occurred to me that we didn't put that on there, but they can go to sashvt.org, and in there you can find any of the numbers across the state that will.
Because you are statewide.
We are statewide. We're in every county of the state. Yeah.
And so, once again, a message to folks out there who may be suffering with this issue, worried about this issue, what's the best thing to do?
Reach out for help. There's resources available. Just call and talk to somebody, text someone, let them help you.
Okay, if we could put those numbers back up on the screen just for another minute maybe, and you could repeat what they are for folks so that they can take this down. The National Suicide Prevention Lifeline is right there. It's 1-800-273-TALK, and that's 24 hours a day, 7 days a week. So that's a good resource to have. And then in Vermont, once again, here are the contact information. Maybe you could go over that again.
You can text VT to 741-741 and have a text conversation with a trained professional. You can call 211, and 211, although it is not staffed 24 hours a day, 7 days a week, they will direct calls to a suicide hotline in their downtime. So that again is 24/7, and you can go to www.mentalhealth.vermont.gov.
And it's really important too to have these conversations with your family, with your friends, if you notice changes in their behavior and some of the things, the risk factors that we talked about, and take it from there, and just keep listening.
Yeah, thank you so much for having us about this topic. I appreciate it.
Well, thank you for joining us. It's very important. That's our program for today. I'm Judy Simpson. I'll see you again next time on Across the Fence.